Welcome back to Great Day. Okay, so some of you are new, some have chosen before, whichever category. Don't ignore open enrollment. Get it over with before getting wrapped up in the holiday hustle and bustle. Justin White, CEO of Senior Health Services, can help you sign up for the plan that best suits your needs. And by the way, that help is free. Yes, that's two syllables, free. All right.
I love it.
Okay, when it comes to things like Medicare, for some people, as I mentioned, it's going to be new for them, so they're completely confused. Other people may have chosen before and they just don't want to deal with it again because it is a little bit of a process, but that's why you have the Help You Do. But we need to understand that Medicare is there for a reason.
Absolutely. It's a federal program, very popular federal program for people that are aging in at 65, and then for others that have a disability of some sort.
Yeah.
They can be before 65, and then other conditions like ALS and end-stage renal disease and things like that. Yeah. But it's very popular, heavily subsidized by the federal government.
And the reason why is because, as we know, you can save for retirement. It can be wiped out with one medical crisis, right? So this way it helps you to negotiate that.
Absolutely.
All right, and live more quality life. Okay, Senior Health Services, tell us exactly what you all do.
Well, we're what's called a brokerage, and a brokerage means that we go out and shop everybody in an unbiased fashion, and we can look at what somebody has and literally just kind of run it through a computer program, and it just goes out there and finds what the options are that might help somebody, and then we can ask them questions about what they need. And so we can go in and, one person may have one thing, it may fit better, and another person will have another one, but we can burn down to what's going to help them the most for the coming year.
Yeah. There's an annual open enrollment period. It was a 3-week run, ends on December 7th. And someone asked me to go, well, why do we have to keep doing it again? Well, life doesn't stay the same. And that's probably the biggest thing. One of the biggest mistakes you say seniors make is doing nothing.
Right. That is when somebody comes in and they go, well, my plan's just not working that well anymore, and we'll ask them, the first question is like, well, how long have you been in that plan?
Yeah.
And they go, oh, about 8 years. I'm like, well, that's the reason it's not working.
Because what has happened with you in 8 years in terms of your health, right?
Yeah, they can change, and then the plans are they're updated in different ways. Sometimes they're just kind of forgotten about, because there's new stuff coming in. You know how that is.
Well, there's changes.
Absolutely,
this year.
Totally. Yeah, now, for example, there's more changes this year than in recent memory. And a lot of it's because the Inflation Reduction Act's bringing in some new changes that are going into effect in January. And they changed the Part D, the prescription drug portion. And so some people are going to be affected not very much. A lot of people are being affected a lot. And they just need to look at the information around them. They'll get an annual notice of change that comes in September. Read that. Look at how your plan's going to change. And if you forgot that or threw it away because it looks like junk mail, reach out to somebody, your agent or somebody like Senior Health Services, so we can go, okay, here's what you look like next year. Is that going to work?
Yeah. And you can walk us through it, and you can answer questions. All right, who in particular, it should be everybody, but who in particular should really make sure they look at these plans with y'all?
Man, this coming year, anybody that's on a lot of medications, anybody that has, their doctor has stopped taking their particular plan, we're seeing a lot of that. There are thousands of people across town right now that are actually being terminated from their plans.
Ooh.
And it's because the way that Medicare is funding the Part D program, the prescriptions, has put more pressure and more money that's got to come from the carriers. And they didn't get any more money appropriated to them, so they're having to go into the plan benefits and slice and dice and shift that money over into the drug part to pay for it.
So, okay, so if someone's getting terminated, I'm going to guess that if you're not really on top of it, you could be terminated and not know it, and then show up and try to have coverage, and it's not going to be there.
Absolutely. I had somebody come in yesterday, exactly, same thing. Came in yesterday, goes, how's my plan going? And I looked at their plan, I go, your plan is done. They go, what? Are you kidding me?
That's crazy.
Said, yeah, December 31st, it's gone.
Wow. Okay, so that's another important reason why, just to see where you stand, and then you can go over everything with them. And as we mentioned, these services are free.
Completely free.
Yeah, and then so when someone sets up an appointment, how does that work?
Well, when they set up an appointment, it doesn't matter where they are in town. And if they don't want somebody coming over, we can work with them over the phone, or I can have somebody go to their home, or they can come to one of our offices. We got locations scattered throughout town. So when they come in, we literally just sit down with them and do what's called a review and just look at what they've got. If they're in a great place, we tell them that. If there's stuff, we ask them, what's going on with your plan? What do you not like? And when they tell us that, then we look at what's available in the entire area and try to fix whatever's going on. And most of the time we can.
Yeah, one of the things that people do so easily is procrastination. And as we keep marching toward that December 7th deadline and the holidays start, so I'm just going to say, because I help my parents with this, and I turned them over to someone like you. So I was like, I'm not going to figure it out for you. So because I can't. So if you are a child of someone who's eligible for Medicare, please get in contact with them. Let them figure it out. If you yourself are eligible for Medicare, have them look at that for you. So if someone's already signed up for a plan and maybe is thinking maybe I made some mistakes, or can they go back to you to get a review?
They can absolutely. Even if they've signed up already this year, they can make changes as many times as they want to before the 7th at midnight. December 7th when it's over. And talk about procrastination. The election, oh my gosh, the election is the number one. They're like, I got to see what happens with the election, and then they put it off. So we're expecting a tidal wave, and I've never seen it more busy than it is right now, which is awesome because they're reaching out and looking at what their plans are going to be changing to and what they need to do. And that's largely because being able to come on to shows like this and just get the word out to people, just get it looked at, just get it reviewed.
That word free, and I love it because I know some people are going to make some changes because like, well, Gladys told me she's got this. Honey, we need to get that too. All right, to get free help with finding a Medicare plan that works for you, visit seniorhealthservices.com. That's seniorhealthservices.com, or give them a call at this number, 281-894-7540. Again, that number is 281-894-7540.